Hello, everyone. Welcome to Clinical Dimensions with Dr. O. Today, we will focus on the signs and symptoms of depression. Here are the signs and symptoms of depression. Depressed most of the day, nearly every day, usually for a 2-week period. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. This just basically means that you're losing interest in the things that you once enjoyed. Significant weight loss when dieting or weight gain, or decrease or increase in appetite nearly every day. Because you are so depressed, you either eat too much or you're eating not enough. A slowing down of thought and a reduction of physical movement, observable by others, not merely subjective feelings of restlessness or being slowed down. Other people are beginning to notice that you are listless and not moving around the way you used to. Fatigue or loss of energy nearly every day. You don't want to do anything. Your mind may say, I want to get up and there's a list of things I want to accomplish. But you're not doing it. You're not accomplishing anything. You're just laying around, like in the bed, watching TV, on the sofa, not getting out. You're not doing the things that you once did. Feeling worthlessness or excessive or inappropriate guilt nearly every day. There's something that may have happened in your past that you feel guilty about, and so your focus is there, and as a result, you're feeling worthless. Diminished ability to think or concentrate or indecisiveness nearly every day. That's explanatory. You just can't concentrate on anything. Recurrent thoughts or death, recurrent suicidal ideation without a specific plan, or a suicide attempt, or a specific plan for committing suicide. Basically, you just want to end it. You're that depressed that you no longer want to be here. This is very, very clinical. This is a criterion that psychiatrists, psychologists, therapists, social workers focus their attention before they give a diagnosis of depression. But there are other things that we consider when we diagnose someone with depression. So in order to receive this particular diagnosis of depression, these symptoms must cause the individual clinically significant distress or impairment in social, occupational, or other important areas of functioning. So in other words, the person is losing the quality of life. It's very, very low. And so we want to see the client with the best quality of life possible. And the symptoms must also not be the result of substance abuse or another medical condition. And basically what this means is that when there's a medical condition, it can bring on depression because of some type of chemical imbalance that may be occurring in the brain, or because of the medication that the client may be taking. Also, not the result of substance abuse, because when someone is actively using a particular substance, they may feel high, but when they come down off of the high, they may feel symptoms of depression depending on the type of substance that they're taking. So basically, the whole idea is to ensure that the client is not actively using substances, have been free from substances for a period of at least a month to decide whether or not this person is actually depressed. Now, once the substance abuse is under control and the person is no longer actively engaging in substance use, have been detoxed, have been in treatment for a period of time, then we go back and we reassess this particular client to ensure that the depression is depression and not the result of substance use. So I hope you understand the things that I explained to you as far as the sign and the symptoms of depression. And basically, why should you know this? You should know this so that if you feel any of the symptoms, then you should contact the nearest therapist. If it becomes too bad and you're having suicidal thoughts, you should report to the emergency room of any hospital who is equipped to help you. They have psychiatric personnel that's on staff to assist you. Also, you should know the signs and symptoms if you are taking any type of medication for depression, so that we can measure if the medication is actually working for you and if it is alleviating your symptoms. So basically, you have it, and you can replay this video over and over again. And if you need my assistance for anything, you can contact me on 443-813-5677. If I'm unavailable, you can leave a text message. Again, the number is 443-813-5677. I am Dr. O, and have a blessed day. And remember to love always.